Stephanie, Kendall, and John, and we're here to talk to you guys about aspiration precautions and ensuring safety in our patients at 6 North.
Aspiration is the inhalation of secretions or food into the lungs. When a patient aspirates, they are at a high risk for developing a bacterial infection known as aspiration pneumonia. Aspiration pneumonia not only causes shortness of breath, it also leads to hospital readmissions and in some cases can be fatal.
As you all know, many of the patients on our floor are cognitively impaired, have one-sided facial paralysis, difficulty swallowing, or slurred speech. These neural deficits place patients at higher risk for aspiration.
It takes a multidisciplinary team to make sure our high-risk patients are safe. As care partners, you're on the front lines of early detection. The following actions are evidence-based practices that you can implement to help prevent aspiration.
The best position for patients to be in while they eat is up in a chair with their feet on the floor. However, if they are unable to sit in a chair, the head of bed should be at 90 degrees. You should not feed a patient if they are fallen asleep while eating, unable to be awakened, or drooling while eating. Other signs to look for include coughing while eating and sudden change in voice. If any of these things occur, stop feeding the patient and immediately notify the RN.
Oral care is critical in preventing aspiration pneumonia. Contaminated oral secretions passing into the lungs predispose patients to infection. The best practice would be to brush the patient's teeth with a soft toothbrush after every meal. At the very least, oral care should be completed daily. If a patient has a feeding tube, make sure the head of bed is at 30 degrees or higher at all times.
So with patients on aspiration precautions, it's important to have the room set up with the proper safety equipment. This includes the suction canister right here, suction tubing right here, and then the suction yonkers, 2 different types. To set up the suction, fairly easy, put the cap on the canister, conveniently goes into the port right here. Take the small tube, connect it to the bottom of the med bag where the suction is created, and it goes to the vacuum side, where it actually says vacuum. Where it says patient, you want to take the long tubing, which is right here, connect it, and then at the end, where either the nurse or the RT, the respiratory therapist, or the patient themselves has it connected to the yonker. 2 different kind. One is where the patient can control on and off. The other one, where there's continuous suction, just turn it on, either to intermittent or continuous, and that's it.